For decades, childhood obesity has been a healthcare crisis that has plagued the United States. If significant changes are not made within our communities and schools to improve nutrition and physical education programs, the cost will not only be the health of our children, but the health of our wallets. Currently, 1 in 3 young children are overweight or obese. My objective today is to improve the quality of school nutrition while incorporating nutritional education programs and physical activity back into the school curriculum. By implementing these changes, we will be protecting future generations of American children from a life of chronic disease. Additionally, these improvements will have a secondary effect on the U.S. healthcare system and potentially save billions of dollars each year. In 2014, 17% of American youth were obese, which is triple what it was nearly 30 years ago. Excess weight is caused by physical inactivity and poor nutritional choices. We must implement learning objectives for children in our schools that include nutritional counseling and physical education. Obese youth are at risk for serious health issues including type 2 diabetes, heart disease, and asthma. The costs for treatment of these chronic diseases that are associated with obesity have a tremendous financial strain on the U.S. healthcare system. Morbidly obese healthcare costs per capita are more than 81% higher than for a healthy adult. With the current cost of obesity epidemic at $117 billion per year, indirect medical expenses and indirect costs, including productivity lost, we are in a crisis mode and need to make significant changes now. Proposed federal legislation to improve the quality of school nutrition, school physical education programs, and nutritional education curriculums must be identified, including the addition of 60 minutes of moderate to vigorous physical activity daily to maintain healthy body weight and to decrease risk of chronic disease. By implementing a physical education nutritional curriculum into every U.S. school, all children, regardless of their socioeconomic standing, would receive physical and nutritional education. The new physical education curriculum would focus on moderate to vigorous activities, which keep the students moving 50% of the time that they are in class. Learning objectives will be introduced, and the children will be assessed periodically to ensure that they are receiving the full benefit of the program. The proposed activities will include gymnastics, freeze tag, jump rope, soccer, basketball, and track, just to name a few. Additional benefits to regular exercise include improved concentration, memory, and classroom behavior, just an added benefit of my proposed curriculum changes. The nutritional curriculum will serve pre-K to 12th grade and will educate children on the relationship between food and people. The foundation of this program will give children an in-depth view of farming, food production, and natural resources. By reducing obesity, we will help lower costs through decreased office visits and prescription drug refills associated with obesity. Improving school nutrition and incorporating nutritional education and adding physical activity back into the school curriculum are steps in the right direction to lower healthcare costs and improving patient health. In summary, my initial proposal is to create government legislation to support physical and nutritional education within the American school system. My secondary proposal is a recommendation to include tactics for establishing policies and initiatives to combat the U.S. obesity epidemic. Establishing these key components improves the health of overweight and obese children and decreases healthcare spending. Excess healthcare spending affects every American household and is a heavy burden on the U.S. healthcare system and American wallets. Thank you.